Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session. Today we have with us Dr. Elliot and Sklar and Lucy Barylak, and they're going to be talking about caring for people that are suffering with Parkinson's disease. So before they get started, let me tell you just a little bit about them in case you have not heard them before. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. And Lucy would also like you to know that she was a caregiver for her mother for about 10 years. And now, Dr. Elliot and Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare science at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Welcome, Lucy and Elliot.
Thank you.
Thank you so much. Thank you, Glenda and Minerva, and welcome everybody. I just want to say that after our session this morning, we will stay on for an additional half hour for those who would like to ask more personal questions or want more information about what we were talking about today. And the recording will be shut off, and you can also change your name. So there'll be, you'll have, it'll be a very private little session. So yes, we are talking about Parkinson's disease. I want to tell you that April is Parkinson's Disease Awareness Month, and that's why we're doing this. But for patients and caregivers of people with Parkinson's disease, every single day of every single month of the year is Parkinson's Disease Awareness Month. Parkinson's disease is a progressive disorder that affects the nervous system and parts of the body controlled by the nerves. Symptoms start slowly. The first symptom may be barely a noticeable tremor in just one hand. Tremors are common, but the disorder may also cause stiffness or slowing of movements. Parkinson's disease is one of the most prevalent neurodegenerative diseases worldwide, named after James Parkinson, who in 1817 described the shaking policy. There are over 200,000 cases of Parkinson's disease diagnosed in the U.S. each year. During our presentation today, we may refer to Parkinson's disease as PD. So welcome, everyone, and we are going to continue.
And there might be some terminology that you're not familiar with. We are going to try our best to explain everything as best as we can. But if something is not clear, please feel free to ask. You can certainly raise your hand or enter a question in the chat box. There's so much information about Parkinson's disease. It's so hard to pack everything into just one program. So since Parkinson's disease progresses differently for everyone, being the care partner to a loved one with Parkinson's can feel daunting. Now, worrying about the many possible futures can also leave you feeling out of control, which is something we talk about in a lot of our different programs. And previously, we've hosted sessions on dealing with uncertainty because some diseases have more uncertainty to them than others. For example, the progression of Parkinson's disease, as well as the hope for new treatments. And that can leave caregivers feeling anxious. Some family members know that something is going on with a loved one. They might see early signs before an official diagnosis is made, but Parkinson's diagnosis can certainly still come as a shock and often misclassified as perhaps denial because people ask, how does the doctor know for sure and what tests can be run? The challenge with the diagnosis of Parkinson's disease is that there are no definitive lab or imaging tests. So, do you get a second opinion? In many cases, people do. And a neurologist known as a movement disorder specialist is really the most qualified to make a Parkinson's disease diagnosis. There are a lot of valid questions that people have about the diagnosis process. And so let's talk a little bit about how the disease is diagnosed. So Parkinson's disease is a clinical diagnosis, which means that an individual's history, their symptoms, and a physical exam are often used together to make a diagnosis. But as I mentioned, there isn't a specific lab test or imaging test that can diagnose Parkinson's disease. So it's not like diabetes, for example, where a blood sugar test lets us know that there's a certain diagnosis. There are certain tests, such as an MRI, also a dopamine transporter scan, which is called a DAT scan, or blood work that can be used to support the diagnosis of Parkinson's disease or to rule out medical conditions that can mimic symptoms. So, for example, some of us are just regularly a little bit more shaky than others. I'm one of those people. That's a totally benign condition called essential tremor. It's a nervous system condition that causes involuntary and rhythmic shaking. So just having a shaky hand. But for some people, that can trigger some concern about Parkinson's diagnosis or predisposition, and one has nothing to do with the other. So essential tremor is not a dangerous condition, but sometimes it can actually be confused with Parkinson's disease. The key here is that Parkinson's disease is not just about a shaky hand or a tremor, and that's why making a diagnosis can be difficult, especially in early stages before the disease progresses. So, what are some of the symptoms? A person's face might show little or no expression. Their arms may not have normal movement as they walk. They may not swing normally. Their speech might become soft or slurred. Parkinson's disease symptoms also worsen as the condition progresses over time. And although the disease can't be cured, there are many medications right now that can significantly improve symptoms. Occasionally, health providers may also suggest things that are more invasive, like surgery, to regulate certain regions of the brain and improve symptoms. An internist or family physician is usually the first to make a diagnosis, and many people will then seek an additional opinion from a specialist, like a movement disorder specialist that I described a little earlier, or a neurologist with specific training in the assessment of Parkinson's disease. Now, the newest criteria for diagnosing Parkinson's was developed actually by the International Parkinson's and Movement Disorder Society, and it reflects the most current understanding of the disease. So to consider a diagnosis, the person has to have what is called bradykinesia, which is slowness of movement. There's a lot of terminology today. And in addition to that, a person must also have shaking or tremor in a limb that usually occurs while it is at rest, stiffness or rigidity of the arms, the legs, or trunk, trouble with balance, and falls. And so a neurology appointment is often the first and most important diagnostic tool for Parkinson's. And that, like I said earlier, includes a medical history and physical exam. A neurologist will usually make a diagnosis based upon symptoms, existing medical conditions, family history, lifestyle factors, and also certain medical conditions, as well as some medications can cause symptoms that are similar to Parkinson's. For example, some antidepressants can cause some motor disturbance or shaking as well. So that's why part of the diagnosis actually involves ruling out other things. And a neurologist is really the best trained to be able to do that. But it's important to keep in mind that there are physical symptoms that also assess the agility of arms and legs, muscle tone, gait, and balance. And these are tests to see if expression and speech are animated, if the tremor can be observed in the extremities when they're at rest, And again, about the stiffness that I was describing, sometimes people also have changes in walking, the size of their step or their ability to turn. You can also check about maintaining balance and posture. That's something that a doctor will also examine. So it's a complicated diagnosis, unfortunately. Your neurologist actually uses what is known as a unified Parkinson's disease rating scale. This is a universal scale that has been used to examine a person with Parkinson's. There are also some newer diagnostic tools because Parkinson's disease includes a loss of neurons that make the neurotransmitter dopamine. So a doctor may want to start a medication to help replace dopamine or increase its effect in the brain. And these medications are known as dopaminergic medications. Again, lots of terminology today. Most commonly, people with Parkinson's will see improvement in the speed of their movement, stiffness, or tremor once they start these dopaminergic medications. A lack of response to medications may actually prompt a doctor to seek an alternative diagnosis and order further tests, which is not uncommon, such as an MRI, as I mentioned, and that thing that I mentioned too, a DAT scan. So a DAT scan is actually a dopamine transporter scan. Rather than looking at the structure of the brain, which is what an MRI does, this scan looks at the function. And so it is a better way for doctors to see if dopamine is being transported correctly. There's also more recently a skin biopsy test, which is newer, but it uses a pathological test and a skin sample to confirm the presence of a certain chemical in nerves, which carries a protein that is essential in the role of Parkinson's. Now, this test can help doctors, again, confirm a diagnosis. But what's unique is that all of these different tests are used to help confirm. None of them, again, are 100% accurate. So it's a complex process, and it makes it very challenging for caregivers. We've included actually a resource here at the bottom for the Parkinson's Foundation because they have dedicated support for people and for caregivers who are going through the process of working on making a Parkinson's disease diagnosis, which can take some time and challenge. So I know I've said a lot. Before we continue, I just wanted to see if anyone had any questions about some of the scientific stuff I was talking about. I know it can be a little difficult to process.
A lot of information, Elliot, for sure. So if you have a question, you can unmute your microphone and just speak up. The chat box is open. If you would rather put your question there, we'll be happy to address that from that format also. I bet you had to practice some of those words, Elliot, because they were difficult to pronounce.
Well, fortunately, I teach medical students, so this type of terminology is not new to me, but it is hard to pronounce sometimes, yes.
Yes.
Yes, you were saying an awful lot and very interesting. One of the things that stood out for me is the skin test. I never heard of that. And so because it's so new, maybe if you could just talk a little bit about it so that it's clear.
The skin test involves 3 biopsies that are taken from different parts of the body under local anesthetic, non-invasive. But what is examined is a specific protein in the skin that is unique to Parkinson's disease. Again, it's been FDA approved, but it's not used as a gold standard among clinicians. And that's why many people seek multiple opinions. And sometimes doctors feel more strongly about certain diagnostics than others, and it can be very confusing for patients and for caregivers.
Okay, thank you for that. So that really clarifies that. So, there is a lot of information and the fact that you said that it is hard to diagnose it. I kind of want to speak a little bit more about what caregivers may be going through. So as you begin researching the disease, and that's important for you to do, and what it may mean for the person with PD, you will also have to figure out what it means for you. We always recommend learning as much as you can about the illness that your care recipient has going through, so that you have a better understanding and anticipating of what you may have to face in the future. But keeping in mind that not every person is the same. I mean, the disease is so different for many people. So Parkinson is a progressive disease, that's for sure, that can make it hard to find your role in your loved one's journey, as your involvement and responsibilities will change along the way. Think about how you will share the diagnosis with family, assess your work-life balance, and prioritize your own needs. At the same time, you need to keep in mind that should involve the person you're caring for as well. So as your loved one progresses through stages of Parkinson's, which is at the different pace for everyone, you can go through stages of caring. So that's important. It's not going to be stagnant. Learn about the disease early on so you can participate in healthcare discussions, make informal decisions, and provide emotional and physical support on a now and as needed in the future. So getting educated really is a good idea, because if you're going to see the doctor, you could ask the questions that you need to ask. So what should I expect as the disease progresses? Many caregivers ask that. So as Elliot said, while medication significantly reduces PD symptoms early on, and for many years, eventually, many people with Parkinson's notice that controlling symptoms become more difficult and requires medication adjustment. So you may notice, for instance, inconsistent responses to medications. Sometimes they fluctuate, known as on-off fluctuations, as changes in the ability to move often is related to when medication kicks in or to when they start to wear off. Fatigue is one of the main side effects of medication. This makes it hard to plan activities, as you cannot predict physical ability, and caregivers need to be flexible. It's not easy, but it's part of this disease process. And then there's also the whole idea of mood and cognitive changes to how the person feels. Things and reasons can be more frustrating than movement symptoms for both you and the person with PD. There could be anxiety, apathy, and depression are common mood symptoms that people with PD can experience. Medication and non-medication treatments can help relieve these moods and symptoms. We're going to talk a little bit more about that. And then you really need to consider new safety considerations. If symptoms begin to significantly affect mobility, memory, or thinking skills, it may be time to consider if it's still safe for the person with PD to perform the tasks that they did before easily as part of their daily routine. For example, driving may become too risky for your own family safety and others on the road. Giving up driving is an enormous loss of independence, and many people can create a new, it's really very, very hard. So these are some of the issues that caregivers are facing in this particular situation. Elliot will also speak about safety in the home and ways to prevent falls, which are common, obviously, with people with Parkinson's. So as I'm going along, I'm just wondering if there are any questions at this point or any comments that anybody would like to make.
You can just unmute your microphone and speak right up.
A lot of information. Okay, so we'll continue. People with Parkinson's and the people they care for rarely adjust to living with PT at the same rate, so things keep going on. One day it's like this, one day it's like that. You might need to adjust household and lifestyle responsibilities. For example, Should you take over the finances? That's something you might have to think about. Is it time to hire someone to do the yard work, whereas the person you are caring for may have been doing that? This can be hard transitions for the person you are trying to help. They may resent these changes, but eventually it's part of the safety that you have to look into. So one of the key differences between caring for someone with PD as opposed to someone with Alzheimer's or any other dementia is cognition and the person's ability to know and remember what is happening and how you are reacting to these. Though PD can also have a progression in cognitive, it can really become very evident that they are having a lot of difficulty with memory. Because of this, it is so important to communicate honestly with your loved one. That might require help of a social worker or a counselor, but it's very important to come together to support your loved one and to include them as much as possible. And I think it's important to find a Parkinson's support group in your area and different ways of really dealing with this situation. And I just want to give you, I'm looking at yes, and there is information that you can call the Parkinson's Society. There's also some unique communication challenges that I want to speak to you for people with PD and communication strategies for caregivers as it becomes harder for someone with Parkinson's disease to process information and communication clearly. So let's look at that. Remember that we listen and understand best with our ears and our eyes, okay? So you need to gain attention and eye contact with the person before you speak to them. Very important. Or, one of the things you can do is call their name first to be and be in the same space or in the same room. Don't call them out like if you're in the kitchen and they're somewhere else. It's very important that you gain their attention. It's also important to reduce the background noise when speaking. Turn off all radios, televisions, and noisy appliances. Be an active listener. Look for hints from eye contact and gestures. Try and figure out what exactly are they trying to tell you. Maintain a normal level of voice volume. Resist the urge to shout, even though you might think they don't hear you. They hear you, but it's the comprehension that's getting in the way. And as you see on the screen, the best way of communicating is the word speech. So let's look at that. S, spotlight your face. Keep it visible. Let them see you. Use good visual cues. Keep a good distance, face the person, all right? And then P, pause between content and sentences. Use clear speech. Don't ramble on and slightly pause between sentences or words, allowing the person to grasp what you are trying to tell them. Now, E is again, emphasize and be patient. Try to keep your cool, even though it's difficult. And then the next E is, listen, get their attention before speaking. So it's really very important to do that. C, control the circumstances. Try to make sure that the environment is controlled and there's no noise around so that it's very clear. And H, have a plan. Try to anticipate difficulties and identify strategies that may work in advance. So all that we're saying is that it's really important if you want to communicate with someone with Parkinson's is get their attention, speak and be calm, make eye contact, listen to their expressions, and try to communicate in the best way that you can. So again, does anyone have any communication challenge or any other questions that you may have? And now is a good time to do so.
We'd love to hear from you. So please just unmute your microphone or type us a message in the chat box.
Yes.
Communicate with us as we're speaking about communication.
Yes, and I know it is a lot of information. But if you do have any concerns at all, even about something that we're not talking right now, but you
I
are
see
dealing
that.
with traumas.
I see that Susan has unmuted her microphone. Susan, please go ahead.
Oh, sorry about that. I actually didn't do that on purpose.
Oh, okay.
I have kind of a unique situation. I am caring for a husband with Parkinson's, but in addition, we are also raising a 12-year-old grandchild. So our communication is really one of the roots of all of our frustration. The 12-year-old, of course, doesn't understand patience and quiet and, the deliberate communication you have to have with his papa. And then, of course, papa gets frustrated and there's lots of yelling, and any hints or tips on how I can educate my grandson to help make life easier. My husband and I have very little problems communicating. I can take my time and make it quiet and get his attention. We don't have a problem. But with that grandson in the mix, kind of all heck breaks loose.
Well, let me say, under any circumstances, dealing with a 12-year-old is extremely difficult. They are teenagers and they're trying, to assert their own independence. So keep that in mind. It is difficult, I'm sure, and thank you for sharing that. I think the best way to do that is really to try and let your grandson know that you need his help, that you would like his help in dealing with that, and that his papa would appreciate that as well. And in very, very simple language, explain the difficulties that his grandfather is going through and how can he be of help to you and to him. It's not going to be an easy process, that's for sure. The other thing is it all depends of how difficult the situation is escalating. It might even be a good idea for your grandson to maybe have some counseling himself to just have a better understanding. He might be frightened of what's going on with his grandfather. And he's not quite sure of what is going on. So I think really educating him and making him aware that you need his help and that both his grandparents love him very much, and we want to find some form of communications that isn't yelling or screaming. I don't know, Elliot, if you want to add anything to that, so go ahead.
Well, Susan, I think you were going to say something.
We are in counseling, and so we've been addressing it for quite some time. And frankly, I just think it's the middle school heebie-jeebies trying to find themselves. I think middle schoolers are insane in general. So I just may have a couple more years until we get to a more mature level.
But if you could try and ask him that ask him if that you would like help, that you need some help. And how can he assist you in dealing with this situation? Try that. I don't know if you have, or in counseling if you've talked about it.
We keep trying, but I think it's like water dripping on a rock. We'll just at it.
Well, thank you for sharing.
I love your idea, Lucy, in terms of approaching it almost from a woo, how you can perhaps convince your grandson to assist you or to do something that would better his papa's life. I don't know him, so I don't know what his woo might be, what specific things you think might help in that communication. But from my experience with working with people of that age, sometimes an authority figure can actually be very helpful in just making the point very clear that this is a medical condition that needs to be addressed by your grandson in a certain way. And you might want to reach out to the Parkinson's Foundation. We have their contact information on our last slide of resources. They have counselors, social workers that are available by phone, but also by video. And perhaps you could set up a video consult with them at a time when your grandson would be home, so that they can perhaps serve as an authority figure on this issue and perhaps provide a little different of an approach. And maybe that would be helpful. It's worth a shot.
Thank you. All great suggestions.
Thank you so much for sharing with us. Anyone else? All right. Well, now it's a very important topic because preventing falls and creating a safe space within the home environment is so incredibly important for caregivers of individuals with Parkinson's disease. And it's one of the rare times where I actually say carpeting is great. Usually as people get older, we try to move toward solid flooring to make it easier for wheelchairs, walkers, etc. And while that does sometimes happen with the progression of Parkinson's disease, carpet can really help to cushion falls. It can also give you a little bit better tread. So it's one of the rare instances where I say carpeting can actually be really great. But please be, mindful about decluttering. The easiest method for preventing falls is to keep your flooring neat and tidy and remove any clutter or debris or anything that's blocking hallways, especially staircases. Sometimes we put decorative plants and things around. Sometimes these things can be tripping hazards, especially if leaves from a plant fall. I know that this happens sometimes. It's also important to just evaluate things to remove tripping hazards. Sometimes home fixtures can actually contribute to falls. This can lead to back pain, other injuries secondary to Parkinson's disease. So examine each room routinely for loose carpet. And that's a big one, even though I just specifically mentioned carpet, you do need to make sure that it's properly secured to the floor. Slippery throw rugs or wood floorboards that stick up can be quite dangerous. So replace, remove, repair, do what you need to make sure that you can prevent falls. The other thing, especially for bathrooms, is grab bars. And this is something that actually might be covered by your health insurance, depending on the plan that you have. But modifications to the home are often covered, especially if there's a clinical diagnosis of Parkinson's disease. You'll want to have grab bars and handrails in the showers. These devices are also very important for making sure that your stairwells, if you have them, have secure railings, that it's easy to get up and down off of the toilet or in and out of the bathtub without injuring yourself. You also want to make sure that that person doesn't wear clothing that is too loose or poorly fitting, because that baggy clothing can sometimes slide down and make it more likely for you to fall as well. So sometimes tighter fitting clothing that doesn't bunch up toward the ground, that's very important, and people don't really think about that very much. Lighting is incredibly important. Inadequate lighting is a major hazard. So install brighter light bulbs, for example, in the hallways, in narrow areas. You might want to consider night lights for bedrooms and bathrooms to help with better guidance. And if you do have tile or wood flooring that can be slick, please, please, please get non-skid footwear. There are socks that have grip on them that are wonderful, gripper socks. You can find them on Amazon, you can get them at Walmart, but they really considerably reduce slipping risk. That's why, in addition to various other reasons, hospitals put them on patients. But grips on the soles of the feet are very, very important. I can't overemphasize that enough. And use technology to help. There are new things now like smart lights, and you can say, hey, Alexa, turn on the lights. And if you fall, you can also, dispatch help, either through Alexa or your iPhone. Best Buy, as an example, has a geek squad that can also install all kinds of things in your home to make your house a smarter home, so that it is safer for you. Many people are getting laminate or tile flooring and getting rid of carpets, which can be a great thing for many reasons, but please do consider that surfaces do get slippery, especially when they're wet, and that carpeting is much more, for a loss of a better word, it's softer than falling on a tile floor. I know this from personal experience this past week. Love my 17-year-old dog, but not when he has accidents. So we need to always be mindful, especially as we're caregivers for people with Parkinson's disease, that falls are a major issue. And it's important that we consider the home environment as people are progressing in their illness as well. Any questions? Any tips that anyone wants to share that might be helpful for others? All right.
Okay, so we receive quite a few emails, questions about certain things, and we wanted to share this one with you. I'm going to read it out in case somebody's just on the phone. My husband Joe and I have been married for over 50 years. We have a very nice family and a good life. About 1 year ago, I noticed that Joe's hands would shake periodically. I finally convinced Joe to go see his doctor. Unfortunately, after many tests, Joe was diagnosed with Parkinson's. We were both shocked. Although the doctor did explain what the disease was all about, I'm still confused and anxious about the future. Joe is on medication and has become very withdrawn and not himself. Lately, I can see that when he starts walking, he sometimes stops and it's hard for him to continue walking. I don't know what to do or how I can help Joe. This has put a strain on our marriage and relationship. Joe does not want the family or our friends to know about his diagnosis. I feel so bad for him and for myself, and I feel totally lost. Well, I want to really thank you for that email, and I'm truly, truly sorry for what both of you are going through. You know, I really hope that this session will be helpful to you and to your husband. We are always saying that educate yourself is very, very important. For you to get all the information that you need about Parkinson's disease so that you can negotiate with doctors. You both need support to get used to this new reality. And for you as well as being a caregiver, I think you need to give your husband a little bit of time to adjust to his reality and respect his wishes at this time if he really doesn't want to share any of this information. Eventually, he'll come to a point where he will, and I think it's important for you both to share with family or trusted friends so that they can be there for you as well. I think it's so important to have empathy and compassion at this time, not only for your husband, but for yourself as well. But I would recommend for you to really try and get some counseling, and hopefully some counseling for both of you, so that you can work on all different situations. And if, we can go a little bit deeper into that in our half-hour session, just to go to sort of explain a little bit more. So this is a dynamic that's going on. The relationship is shifting as many times it does with caregiving. So I just want to wish you all the very best, and hopefully you will stay with us in the later part of our sessions. I also want to say that science has really it really improved in recent years. It's not trying to necessarily cure something, but rather to see if we can better manage an illness and its progression and symptoms. In addition, COVID in a way was a silver lining, maybe how it has changed the experience of proving new medical treatments and interventions. Patients and caregivers should be comfortable discussing new and emerging treatment options with your provider. And really, as an advocate, as caregivers are advocates many times, if you don't feel like your provider is on top of the latest and newest science, get another opinion. You know, it's really, really important to do that. So I do want to talk about tips for caregivers, if we can do that. So there we go. So I was just talking about this new research, and we had the slide that we're going to go on to the tips for someone with PD. So it's important to manage your time. All right. That's really, and that goes for all caregivers, but especially if you're caring for someone with Parkinson's. As many caregivers know, caregiving is extremely time intensive. Working towards using your time effectively will help ensure that you can make time for yourself and you can care for your loved one. So one of the things that we talk about is get organized, make daily and weekly lists of things to do. Aim for manageable and realistic tasks, breaking large projects into smaller ones, all right? You don't have to do everything at once. And it's important to prioritize, do the most important or difficult things first. Don't do so much in one area that you cannot be effective in the other. Forget unnecessary tasks and delete those tasks that don't have to be done by you, or maybe ask for help. Master the art of multitasking. For some of us, it's easy, and for others are not. Schedule breaks. Resting is necessary and productive. Build into your schedule, you know, on a daily basis. There will be times when the pressure gets too great. Take a break when you need to. Do not wait for exhaustion as your cue. Be proactive and preventive. Balance flexibility and routine. Your loved one with PT, maintain a manageable day-to-day flow. However, it is important to remain flexible. And we keep using that word over and over because of this. They're not only their physical, but their cognitive changes. Some things are beyond your control. Many tasks and activities will take longer for the person with Parkinson's as the disease progresses. There will be days that throw a wrench into your routine. So that's okay. That's what life is all about. But it's so important to be able to have a schedule. Show yourself and your loved one grace. You're both working towards balancing and navigating life with Parkinson's. Prioritizing self-care, health, and respite. We keep telling you that over and over again. If you don't stop to take care of yourself, you will not be adequately prepared to take care of your loved one with PT. There are many ways that care partners can turn small pockets of time into their own self-care and respite time, you know. So it's really important to adjust your expectations. Life and you are not perfect, right? We make mistakes, forgive yourself. Accept changes as they occur. Get help as needed, including emotional help or counseling. Each person experiences depression in a unique way. It is important to take any symptoms seriously that could signal depression. You should not feel embarrassed or ashamed. Remember, acknowledge your feelings. Share the care. No one person is ever able to meet all the individual needs. As Parkinson progresses, this becomes increasingly true. Begin adding outside resources to your caregiving early on. This makes adding other care sources easier as the disease progresses. So hopefully, the person you're caring for will be able to accept that and to let other people know what's going on. Working on your relationship is important. It's likely that you know the person with Parkinson's long before their diagnosis. To have a successful caring relationship, work to maintain your relationship outside of caregiving role, okay? We always tell caregivers that you have a relationship, do things together that don't include caregiving. Work to maintain open communication. Communicating about Parkinson's throughout your journey is a crucial aspect of living well with the disease. So here are a few other little tips. Open and honest communication can be uncomfortable or difficult. It can be especially challenging if your loved one is experiencing speech or voice issues because of the common challenges as well as potential cognitive changes. Many specialists recommend that that you deserve a distraction when communicating. This can have a surprising, significant positive impact on the quality of communication. So remember all the things that we said about communicating. You have to be extremely patient. Good communication takes intention and adaptation. It's not something that is easy to do. But I think sharing your feelings and allowing your partner to share their feelings about the disease is extremely important. And again, nobody needs to do this alone. And many times in my own experience with people caring for someone with Parkinson's, having counseling as a couple really truly does help. So at this point, we'll open it up if there are any questions or any comments that anybody wants to make. You're welcome to do so.
And don't forget the chat box is open. If you'd rather do that format, it's perfectly fine with us.
I do have to say that it's really a hard disease to process. It's difficult. I mean, caregiving in general is difficult, but especially with Parkinson's disease because so many factors come into play. All right. So I'm just looking at the time. Elliot, would you like to add anything at this point, or we can then go back to Glenda and give us a little bit more information on what's coming up?
Actually, sure. Can I go back to talking about research? We went a little off of our order today, but I wanted to share a little bit of a personal experience that I had in a previous job, actually. I worked with a dean who was an environmental toxicologist, and together with a neuroscientist, he had a prolific lab examining things like lead exposure and working on Parkinson's disease and Alzheimer's, which were two diseases that had afflicted members of his family. And now he is someone actually who sits on the board of the Michael J. Fox Parkinson's Foundation for Parkinson's research. And in January, the foundation had announced another new medication for Parkinson's may soon be on the way for approval. So I really wanted to share this because hope and new advances are always so important. So this new medication is called levodopa, and it temporarily replaces the dopamine brain chemical, which decreases in Parkinson's, to ease motor symptoms like tremor, slowness, and stiffness. And it is available as a pill, inhaler, or a gel, which is quite interesting. The medication, what makes it unique is that it works for 24 hours, providing more consistent medication levels for consistent symptom relief. Now, this may be particularly beneficial for people who experience ups and downs with their Parkinson's symptoms, and that's extremely common. Motor fluctuations, for example, are hard to manage adequately through oral medications. So the clinical trials for this drug have shown that nearly 1.75 hours more of on time per day that people felt they had symptom relief, like a lack of tremor, slowness, or stiffness. So the next step on the path for this medication is application for the FDA for full approval. And if approved, the therapy would offer another treatment option for people with progressing Parkinson's who are currently not able to achieve optimal symptom control with oral medication. I wanted to share this because it's a recent advance, and I think that sometimes it's great for us to keep on top of science. I know that time that patients and caregivers spend with physicians can sometimes be brief, and it's hard to have your doctor share all the latest and newest science. So we wanted to let people know that there are new things on the way, and that science, as you said, Lucy, it's really pivoted in the last couple of years in terms of how we're now expediting approval of new advances and treatments and interventions. So I think, as you said, patients should certainly feel more comfortable discussing these things with doctors. And as always, we will share a copy of our slide deck with everyone. But I did want to make sure here to share some specific resources. And the ones that you see with links are actually hyperlinked. We have quite a few resources to share, but I wanted, Susan, for you to have the information for the Parkinson's Foundation for their helpline, as I mentioned, because I think you might have the potential of another strategy in terms of how to approach the issues that you're encountering with your grandson.
Well, thank you for that, Elliot. That was extremely important to share. It's always great when new medications are on the market.
And it's encouraging to hear that
Yes,
there
it
is
is.
something.
Yes, it is.
Yeah, so Parkinson's treatment is not the old Parkinson's treatment, so that's always good news. So if I may, let me tell you a little bit what's coming up on the Caregiver Teleconnection. Our next session is going to be Monday, the 10th at 12 o'clock noon Central Time. Shelley Young is going to be with us talking about the 10 warning signs of Alzheimer's disease. Always nice to have a heads up when you're facing something like that. And it's sponsored by the North Central Texas Caregiver Teleconnection. On the 11th at 10 o'clock Central Time, there's a Spanish session with Dr. Berdario. If you have any caregivers or friends that you know that are caring for someone, then they are primarily Spanish speaking, please have them tune into that. Minerva, are you on there, and can you tell us exactly what the topic is on this particular session on the 11th?
Yes, hold on a second.
My Spanish is not that good. I apologize.
It is not a problem.
It's about dementia. I can tell you that.
Dementia and the family dynamic.
Ah, there you go. So if you know anyone that's primarily a Spanish speaker, this would be a wonderful session. And he's a wonderful presenter, very caring and warm presenter, Dr. Berdario is. And then Lucy and Elliot will be back with you on Wednesday, April the 12th at 10 o'clock Central Time. This is the second in their series, Our Health is Our Wealth, a health promotion series for caregivers. And I think, is this where you wanted Myra to speak a little bit, Elliot? Okay.
Yes, she's doing such an amazing and inspiring job. I think it would be great for her to share how exercise has been helping her the last few weeks.
So Myra, just unmute. There you go. Your hand is right. Just unmute your microphone and go ahead. There you
Yes.
are.
Hi. So you want me to talk about my my experience now with the exercise?
Actually,
no?
on Wednesday when we do our program on exercise,
That's great. I will be there.
I would love you to share your experience.
But she is promoting it now. So tune in to hear Myra with Lucy and Elliot on the 12th. So that's all I have from my perspective, just wanting to let you all know about what's coming on the Caregiver Teleconnection. You will have another half an hour with Lucy and Elliot. And if you've been on with me before, I don't hold you over just because the clock doesn't say it's on the hour. So at this point in time, I'm going to stop the recording and I'm going to leave you. And let me just say it's been my pleasure to be with you today. And I hope to see you on future sessions. So let me go ahead and stop the recording at this point. Lucy, Elliot, thank you so much.
Thank
Hope
you.
to be with you again soon.
Yes, thank you so much.
All right.
you.
So I'm stopping the recording and I'm going to leave you now.